This is the October meeting for the Jackson County Local Public Safety Coordinating Council meeting. My name is Eric Geyer. I'm the Director of Community Justice for Jackson County, and I also chair this meeting. This is definitely the part of our presentations today where the mood gets a little more somber. Sorry to introduce you that way, Tanya, but as our local person tracking the deaths related to opioid overdose and other things, it is important to note the framework that we're still looking at substance use within our community, which is that we have people dying and it is devastating. And the hope that new services bring sometimes aren't enough to overcome that. So Tanya, I certainly turn the floor over to you as you bring this to the conversation, and thank you for joining us. Oh, and I also, before you fully take over, I need to acknowledge that you have been so deep in your work regarding our county's COVID response. We are so grateful for it. And that when the executive team was talking about inviting you, there was a really strong air of protection, particularly from Danny Jordan, about how much work you're doing and not wanting to overburden you. So the fact that you made time for this, we're all very grateful. So thank you.
Oh, yeah, no problem. I've been doing the best that I can to keep an eye on our overdose data. But yeah, it's definitely been a hard year for this and COVID. So my name is Tanya Phillips. I'm the Health Promotion Manager here at Jackson County Public Health. I'm going to go over really our overdose surveillance and alerting system that we developed in 2018. And really, we developed this system to inform partners and our public about the trends that we were seeing in our community and be able to issue alerts in real time so that we could possibly save lives in that process. So our surveillance system, it is not a way to track the exact number of overdoses, but it's really looking at our first responder system and looking at our overdose fatalities so that we can identify those trends and again issue alerts. So again, we started this in 2018. It was developed due to the sudden increase in fatal overdoses related to illicit or synthetic opioids. And then this was also done in close partnership with the Medford Police Department, Mercy Flights, our medical examiner staff within the Jackson County Sheriff's Office, and then additional support from our healthcare systems to do this work. So looking at 2021, we issued our first alert the very beginning of September. So January 12th. This alert lasted just a few weeks. So typically I would say our alerts really do last anywhere from 2 weeks to 4 weeks. And we issued this alert based on the number of responses that law enforcement, EMS, and also what our emergency departments were seeing. So during this time, there were no fatalities from synthetic opioids. Also during this time, just to let people know that we did remove our colored system. So it used to be green, yellow, and red. And we did away with that. One of the reasons is because media would get really fixated of, well, why a yellow, why not a red? Each time that we would make the determination to issue an alert, it was a little bit different each time. And so it just became a lot easier just to issue an alert without having a colored system there. So then we issued our second overdose alert on February 28th. This alert has remained in place since then, so it's been 8 months. This is our longest overdose alert. During this whole time, we have had the record number of hospitalization, first responder for their responses, and then also deaths as well. And so just to kind of give you some background knowledge, looking at 2019, we technically had 2 alerts that we issued. Again, those were either 3 or 4 weeks. We did one in December that carried over into 2020, and that lasted through January. So that was at 4 weeks, and that was our only one. So again, to have 2 alerts, but then have our last one still in place has been impactful in the sense of we haven't been able to remove that alert and say that we've gone back to normal per se. And then also with this, Tony, you may not like me, but I've been a part of a group looking at Measure 110 for some assessments. And one of the concerns that I did raise was, looking at Measure 110 and doing an assessment on how this may be influencing our overdoses, but also just the drug trends and making things such as fentanyl, which is what we're seeing majority of, if it has influenced any of that. So that is my voice at the table right now. So this is looking at our law enforcement responses. And so I get a lot of this data currently from a system called ODMAP. Medford Police Department and a few other departments put data in here directly where they make a response. Sometimes they do deploy Narcan. Sometimes someone else has already done that, such as a bystander. And so I go through and I'm really looking at the synthetic opioids. So sometimes there are other overdoses related to methamphetamine, sometimes alcohol, cocaine. I'm not pulling those right now. This is really just looking at that synthetic data. So Medford Police Department is one of our agencies that uses this system the most. And so they've been a really vital partner in this to being able to give us an accurate picture about what is going on in the county. So far through week 42 of the year, we have had a total of 172 responses to synthetic opioids. So this is when an individual is overdosing. Majority of these responses, unfortunately, are from our Medford Police Department. In comparison to 2020, there were only 53 responses, and majority of those were from, again, MPD, but we also had talent and Central Point also putting into that system. One thing that's different this year is that MPD is trying to help get a better picture of what's going on in the county, so they are helping us get additional information from the other law enforcement agencies. But overall, I would say, the responses for law enforcement has increased, had a fourfold increase from 2020 to 2021. We're averaging about 4 responses per week compared to 2020, where there was just averaging about 1 per week. Also to take note, which I didn't mention before, definitely pay attention as we go through these graphs, looking at week 26. Well, I'll point with my mouse. Hopefully you can see. So week 26 for most, and then also week 36. So you'll definitely see the trends match between the different agencies. So this one is looking at EMS. So our main provider here in Jackson County is Mercy Flight. And so they give me information directly. The information that they do give me is when Narcan has been documented as an intervention. And with that, then a transport was made to one of the hospitals because further care was needed. A majority of the time, if Narcan is identified as an intervention, it's typically when Mercy Flight staff, the paramedics, are administering naloxone or Narcan themselves. So in 2021, so far, Mercy Flights has had a total of 141 responses where Narcan was identified as an intervention and the person required to be transported to the hospital for further care. In 2020, we had a total of 153. So far we are unfortunately on par to surpass last year's record. So far we're averaging about 3.4 responses per week. So we're expected to see around 175 responses just from Mercy Flights. This one is looking at our overdose admits in our emergency department. So for those of you who don't know, we have three hospitals here, 2 systems. And so that's where that information is coming from, those emergency departments. We use a system called Essence, which is a syndromic surveillance system that we have access to at Public Health. We use 2 queries. These queries are based off of chief complaints, which really covers why the individual is being seen. But then we use diagnostic codes that are used by the hospital to then say, what the reason is for them being admitted. And so I have 2 queries that I use. One covers heroin and the other one is just general opioids, which is kind of my catch-all. And so these 2, again, use those diagnostic codes. So overall, we have had so far this year 169 overdoses where someone was admitted to the emergency department related to synthetic opioids. And again, I'm only looking for synthetic opioids within these overdoses. Mainly, again, most of the time I'm seeing heroin and fentanyl. This year, we've averaged about 4 admissions per week, so very similar to what law enforcement is seeing. In 2020, we averaged 1.7 admissions per week, and in 2019, it was 2.2 per week. And so really looking at from 2020 to 2021, this is a twofold increase. And so again, you see that week 26 and also week 36 all near each other within the system. This year, what has been different in the past, when I'll go through the queries also provide me additional information if there's chart notes, so those get put in there. So I'm able to see additional information such as the type of drug that the person is naming that they used or thought that they used, but also the route that they used to use the drug. So this year, what has been different in the past is that other opioids, what typically would be there would be an older individual, and what would be listed as they just had like something like a hip surgery, and or they were a cancer patient. So you were really able to see that was a prescription accidental overdose. What we're seeing this year is a lot of mentions of fentanyl and counterfeit pills. And so I've had to go through the data and now be able to list out all the different mentions of what the person thought that they possibly were using. So this graph, the blue is just looking at the mentions of heroin, or they were diagnosed, or the diagnostic code that was used was heroin. The orange and the gray line is under the general opioids. And what I did is I went through any mention of fentanyl. I counted it as a fentanyl overdose. And then the gray is just other opioids. So overall, there were 86 admits for a heroin overdose, and then 97 under the other opioid overdose. And then there were 51 mentions of fentanyl that were specifically identified in the chart notes of the individual saying that is what they used. And that's something very different this year than what I've seen in the past. Looking at the other opioids, things that I see mentioned are people saying that they used oxy, blue oxy, dirty 30, or they will describe the pill. So a 30 milligram pill that was blue. One of the incidents that I identified was a couple of teens. They said that they used Percocet, but then they described the 30 milligram blue pill. Percocets do not come in a 30 milligram blue pill. That was oxy, and what I would suspect would be counterfeit as well, just because of the age and being able to access it and just knowing what is going through our community right now. Other ones were, again, mentions of other Percocet. It was called street Percocet, Xanax, people mentioning that they used strange meth, powdered meth, or thought it was meth. In some of the heroin overdoses, it would be mentions of calling it bad heroin. So I would suspect there was fentanyl in the mix there as well. Smoking fentanyl patches. And I mentioned Xanax. Yeah, so those are kind of just, what I can gather from the chart notes. The chart notes are pretty important when we're looking at some of this data. Other information that I found useful, and that has changed quite a bit. So the route of drug use is really important factor, especially when it comes to harm reduction. We know that injection drug use carries the riskiest of them all, just with the spread of HIV, Hep C, other infections, and then the risk of overdosing. Smoking, typically in the world of harm reduction, is a less riskier way to use drugs. If we can get someone from injecting to then smoking, that's a good thing. There's just less risk of infections, less risk of overdosing. Unfortunately, what I'm seeing with the data, though, is when it comes to fentanyl, the risk of overdosing, whether it be non-fatal and or fatal, the risk is still there. It does not eliminate it by any means. And so I'm just finding it's not much safer right now. And so going through the data, what I found is mentions of where there was heroin, they were more likely to be injecting. Where smoking was mentioned as the route of use, they mentioned that they were smoking fentanyl. And then any other opioids for snorting, it either mentioned fentanyl or other opioids like the Xanax or the Percocets. And so also there was a recent study coming out of San Francisco that also noted that they're starting to see less people injecting drugs, especially if they're using fentanyl. So they are seeing more people smoke. So again, that's a different trend as we start to see more fentanyl and pills come through our area. I am seeing that trend change. I'm also seeing our syringe exchange numbers go down because people are not injecting. Clients are even telling us the reason is because people are smoking and using fentanyl. Other information that I found important, the average age of the overdoses was 35 years old. The minimum was 15 and the oldest was 77 years of age. And then the majority of the emergency department admissions were males. And so 75% of that total were males. And then the average age was 35. On to information about looking at our fatalities. So this information, currently, again, I'm pulling specifically looking at synthetic opioids, so fentanyl and heroin, and or anything related to that. I would give a little disclaimer about 2020. There were some staff changes in our medical examiner office, so I wasn't getting that information as I typically would. And currently for 2021, the Medford Police Department is helping me get a better picture and reporting those fatalities to me, no matter where they're at within the county. So they've been really helpful in that process. But as you can see with this graph, currently in 2021, we have 43 fatalities related to synthetic opioids. Some of these are confirmed cases, some of are presumptive, and some are still suspects. So part of our surveillance system, we have three terms that we use. Suspect is just right when it's reported. So the information that we get is sometimes they're a known individual to use heroin and or other synthetic opioids. A lot of times the scene at, there'll be different drug paraphernalia that would indicate that that's what they overdosed from. So that's a suspect case, and we identify that because, again, we want to be able to track the data in real time. And if we need to issue an alert within a day, within a few days or a week, we can't wait on toxicology reports to confirm what that individual may have overdosed from. And so that's kind of the process for that. So looking at fatalities, I did this per month just because there's not an overdose fatality every week. So this is looking at everything per month. We're really averaging right now about 4.3 deaths per month. And that's about a little bit over 1 deaths per week. In 2018, which was our highest year since we started our surveillance looking at illicit or synthetic opioids, we were averaging 1.8 per month, the death. So that's a 2.4-fold increase just looking from those 2 years. And again, these are all record numbers as well, whether it's weekly, monthly, and or just the total for the year. This slide right here is really just comparing heroin and fentanyl, just the number of overdoses there. And so all of these the numbers include confirmed. So we've received toxicology reports back, but also presumptive and confirmed. Presumptive cases for us include sometimes if the tox report will come back that they had morphine, but then the drug scene or the individual, we know that they did use heroin, and sometimes the body would just burn off and it would come back as morphine. So that's our presumptive case there. But so far for the year, we've had 20 deaths related to heroin and or 25 related from fentanyl. 4 of those individuals had both heroin and fentanyl so far identified, whether it's confirmed or looking at the death scene, they're both products were there. We have 1 presumptive case that came back, just morphine. 16 so far of the other drugs, the tox reports have identified other drugs in the system, such as cocaine, meth, marijuana, Xanax, which is important because we have been seeing some counterfeit pills with fentanyl that were labeled as Xanax. And then so far, we still have 25 of the cases that are still pending the toxicology reports. Looking at the demographics, very similar to hospitalization. So average age is 38 minimum, has been 17 years old, and then the maximum so far has been 66 years old. Looking at sex or gender, majority of the deaths are among males, with 76 of the fatalities being males and 24 of the fatalities being females. So again, very similar to what we see with hospitalizations. And that is the end of my presentation.
Tanya, thank you so much for sharing that. That is disheartening and devastating to think of the loss in our community, and it heightens the need for our system's response overall to provide supports and services for people when they need it. Does anybody have any questions specific to Tanya's presentation today? Thank you all very much.